I'm going to talk about Ehlers-Danlos Syndrome and the pain that it can cause, which is probably the number one issue that EDS patients bring up and have a problem with. It definitely affects our overall quality of life, our sleep, our immune system. Everything is kind of affected by our levels of pain. So it's something that comes up a lot. And unlike the connective tissue disorder itself, it is something that responds to treatment. So it's often sometimes the only thing that doctors really try to work with on us, when it comes to physical manifestation of the condition. So where does it hurt? That is the question, especially my mother asks me all the time when I'm in pain, where does it hurt? How is it hurting? And unfortunately, it's a really difficult question to answer because EDS in and of itself is a connective tissue disorder and causes very specific things. But with it comes a cluster of conditions, and those come with their own set of symptoms and pain. So to give you an idea of what I mean, my EDS pain is kind of from head to toe, mostly in my legs and my hips, but I can feel it just about anywhere. My hands a lot of times will swell. It's deep within the bone. Their massage doesn't touch it. Heat, ice, those kinds of things don't touch it. It feels like it's so deep inside that you just can't get to it. So it's very much a skeletal pain. On the other hand, because our joints, dislocate so frequently, the muscles around them need to work a little bit harder. So we do have a lot of muscular pain too. The EDS pain, which would be the bone pain, it's an everyday thing. Some days it's a little better, some days it's a lot worse. There are days where I can walk around fine. There are days where I can barely stand because the pain is so severe. Now, onto the cluster of conditions that it can cause. One is a Chiari malformation, which is a problem with the skull. The back of it is not shaped properly, so the brain tonsils hang out of your skull basically and down into your neck. This causes a lot of neurological issues as well as physical issues. Symptoms are very similar to multiple sclerosis, and in fact, some of us were misdiagnosed with that or epilepsy before being correctly diagnosed with Chiari. It causes a very distinct, unique, and severe headache that's similar to migraines. Chiari headaches are one thing that can be sometimes controlled with the decompression or the brain surgery. So another cluster condition we get is a craniocervical instability, which is basically where our neck no longer supports our head. They call it the pumpkin on a toothpick syndrome. So with that, a lot of people end up getting fusions, but you get a lot of neck pain and then headache pain, plus pain in your arms, kind of shoot down, a little bit of nerve pain because you can get nerve damage with that disorder as well. There are other conditions that go along with EDS and Chiari, like you can have a syrinx in your spine or tethered cord syndrome, which come with their own symptoms and their own issues. I do not have either one of those, but the big thing that most of us have, if we don't have it now, we get it eventually, is arthritis. So rheumatoid arthritis and osteoarthritis. And we get them very young. The children have it, teenagers. I have a pretty bad osteoarthritis in both of my hips and then down one of my legs. I have rheumatoid arthritis I have recently found in my left hand. So that's a problem when I'm trying to write. I'm an author, so I use my hands to write every day. It will swell a lot and get red and itch, which is almost as annoying as the pain when it itches like crazy. But my hips are what give me the most problems, and that's because of the osteoarthritis and the bursitis. There's also something called tendinitis too, and runs down my leg, and sciatica. It sounds like a lot, I know, but the point is there's a lot of different things wrong with us that can cause pain. So on any given day, it can be one of those, or it can be all of them. I know that my husband and I laugh because, it's something different every day, and we feel like we're constantly doing things to me. He may sit there and rub my back or rub my legs while I'm putting cream on my hands, or he's squeezing my hands and I've got, the heating pad on my stomach and the ice pack on my legs, and so it's trying to get to the point where you're functional. I mean, you never feel great, but you do all of these little things to help the different types of pain going on in your body, hoping that the culmination of them will get you up and moving around. Other people, I'm sure, do the same thing. It's not just me. Pain management can have a huge effect on the way that we live and the way that we function. I know that when my pain has been controlled, I'm a very productive member of society. I'm volunteering. I'm working 10 hours a day. I'm doing arts and crafts with the kids. I'm eating. When my pain is not under control, I'm having heart issues. I'm having anxiety attacks. I'm not able to get out of bed. My husband is getting me dressed. So, it's a really big deal. It's not just a big deal for me managing the pain or for other EDS patients, but it's a big deal for our families too, because they suffer with us, albeit in a different way, but they're along for the ride. So hopefully this gives you a good overview of the different kinds of pain and what we might be feeling and what might be going on in our bodies. If you have any questions about EDS, please feel free to contact me. I will do my best to answer them.